Dr. Suleiman, good afternoon, and thank you very much for your time this lunchtime on ENCA. I mean, you've been on the ground for a long time, helping with water in the Eastern Cape and a number of other very urgent needs there. Just as an overriding question first, how dire is the situation in the Eastern Cape?
Well, it's dire in many aspects. Good afternoon, Dan. It's dire in many, many aspects. There's a problem with food. There's a problem with water, there's a problem with health services, there's a problem with infrastructure, there's a problem with fodder. So overall, the needs are very, very dire in the Eastern Cape. What's amazing is the resilience of the people in this province. They withstood difficulty patiently. And they've never complained, and they've tried their best to manage with what's been going on. We've been involved in water delivery, food parcel delivery, supporting hospitals and fodder. But in the last few days, in terms of the water situation, we're getting many, many more calls from many more areas. And I'm in the Eastern Cape right now. We've just opened up a facility in Glen Grey Hospital, and I have the MEC of Health of the region with me. And she was also quite frank about the facilities and the challenges they face as a government and as a ministry. And she was quite open about the fact that the hospitals need a lot of support, there's not enough budgets, and we spoke frankly about the health situation. But at the same time, we spoke about other situations also. And I was driving here, and I got lost with the GPS and landed up going through back roads and the dirt roads. And you could see there's no water in the rivers. Everything is dry. The dams are dry. People are calling us. Tribal leaders are calling us. Traditional leaders are calling us. Schools, hospitals, clinics. Everywhere there's requests. There's a huge need for water in various parts of the Eastern Cape, besides the food, medical support, and the fodder. Delivering fodder to animals, and there's so many animals just dying in the province.
Where exactly are you now? I didn't catch that part clearly.
I'm in Grey Hospital in King Williamstown with the MEC of Health, the new MEC of Health, Ms. We just upgraded a health facility, both in Glen Grey Hospital, where I was there this morning, and now this afternoon I'm in Grey Hospital in King Williamstown, where we upgraded a facility for the medical personnel in the hospital.
And the healthcare situation there as well is very dire.
Well, the MEC herself, the MEC is here, and she was quite open in the speech. She said, look, I'm not hiding anything. We are in difficulty. We got many challenges. I'm in this post only for 3 weeks now, and we need as many partners as we can get. Our budget, she said, I came from a budget department of 2.4 billion to a budget department of 27 billion. But while saying that, we got a 4 billion rand shortfall from last year already, and we got a 37 billion rand medical legal bill to face. So without partners, we're not going to manage. And we had to find funding to rehire the contract workers whose contracts expired yesterday. Had they not done that, and the third wave hits us in the Eastern Cape, it would have been a total disaster. And all the support staff, fortunately, they found the funding to make that possible. But she was honest and frank and transparent, and she said, look, we need your help. As a health ministry, we can't survive on our own, and we need partners. And I appreciate politicians who are honest and say, look, this is the problem, can you help? And we have been involved in the Eastern Cape in health facilities now since the beginning of COVID-19, and we intend continuing because we can see the need, and the CEOs, again, in the hospitals have been excellent. They've been hardworking. The medical staff, the contract workers have been very, very upfront and dedicated and committed in spite of all the challenges. They need our support.
Now, Dr. Suleiman, we got in touch with you to talk about the ongoing water crisis, the drought, and how the farming communities are suffering. But you are in the Eastern Cape now. You are in King Williamstown at this hour as we speak to you, assisting with the health sector. So there's a myriad of challenges that Gift of the Givers gets involved with in terms of supporting. But water must be one of the biggest for the area.
Yes, Dan, you can shut down ESCOM, people will survive. You shut down water and people will die. That's the bottom line. I mean, in Makanda area itself, we're helping, and again, the sludge coming out of the dams, there's not water coming through. 19 clinics call us for water. We have water tankers going between different clinics. In Adelaide, it's the same thing. We've got a tanker there. We put in an additional 6 poles. It's still not enough. There's calls from Amtata, Bishu, Kromi, and so many other areas in the province require water. Just 2 days ago, a whole lot of traditional leaders and leaders of a community about 90 kilometers away from Adelaide came to my team there. They said, look, fortunately, the river is working. There's a river that's flowing but the pipe that leads from the river to the towns, it's broken. We can't get water. There's 1,500 families without water. Hospitals call us Adelaide Hospital. I mean, it's a big facility. They've got no water. We're putting bores in Adelaide Hospital. So the situation is dire because whilst we've been focusing on COVID-19, there are other health challenges. And the big challenge is the TB could come back. And the hospitals definitely cannot have the problem of having no water. So there's hospitals without water, clinics without water, schools without water, sanitization, washing hands, keeping clean is all part of the process. How do you fight or tackle COVID-19 or other infectious diseases in the absence of water? How do all people take their medication in the absence of water? Old age homes, childcare facilities, all have a similar problem. It's a huge problem in the state.
Thank you very much, Dr. Imtiaz Suleiman, painting that dire picture there of the lack of water in the Eastern Cape. He's currently at a Gray's Hospital there in King Williamstown with a provincial MEC for health, assisting there in the healthcare sector, which is also battling without water. Not just the farming community, normal households, but clinics are running without water in the midst of the coronavirus pandemic.